All right, so assalamu alaikum, everyone. Welcome to this webinar with Dr. El Nakib. He's a very good, very close friend of mine. He's been in private practice for some time now. So without further ado, Amr, you can go ahead and take it away. Just introduce yourself. Just let us know kind of your background, your education, where you worked.
I lost you there for a second. Okay, yes. Assalamu alaikum. Can you guys hear me and see me okay? Okay.
Yep, I can hear
I'm
you.
good. Okay, great. Just let me know at all, if we end up losing sound or video, anything at some point. Assalamu alaikum. My name is Amro El Nakib. I am a New Jersey resident as well as a former Temple student and graduate. I'm currently practicing in New Jersey. And before I start, I want to thank Junaid for putting this together, and for the rest of the team that has been making posts on the WhatsApp group. The discussion, keeping the community alive. I think it's very, very important that we have this type of group. Especially you realize how important it is when you get out in the real world and see what it's like out there, and also needing support group. So I really thank you guys. Thank you for being here. And I remember really well something with Junaid. We were, I think, he was a third year and I was a second year, and then I remember him telling me that there's not a lot of Muslims or Muslim podiatrists um, that we can look up to and learn from, and I want to change that. And I think he really did. He is changing it, and he's doing a great job, inshallah. So may Allah bless him, and may Allah bless you guys, and keep this thing going, inshallah. So yeah, I'm practicing here in New Jersey. My practice is hybrid, so I do a lot of mobile care. I do a lot of nursing homes, home visits, but I also have an office. And then the other component of my practice is I also do home care, in the sense that I hire certified home health aides, and they do non-medical home care services. So it's an all-encompassing program. There's the podiatry aspect, and then there's the home care aspect, and we try to offer uh, you know the services that we know that our client and our patient is going to require, and we try to basically adhere to their needs. I've been in practice since 2022. Started off as in a multi-specialty group, and then later on, I went on my own back in 2023, and alhamdulillah, it's been going really well. Right now, we're in about 13 facilities, and they're a mixed bag of assisted living, nursing homes, rehab centers, long-term care, adult daycares. So we try to cover as many facilities as possible. And when I say we, I'm the sole provider, but then I have my staff who also does the home care and the other type of services, the non-podiatry related services.
Got it. No, Jazakallah for sharing that. I may be in and out. I think my service is spotty today for some reason. But just to kind of go off of some of the things that you said, how did you go about like hiring people and, kind of that whole process of having your own practice, like, was it a lot of work or was it not?
You cut off for a second, but I think it was about how did I hire people? How did I go about my doing my own practice? Okay. So the saying goes, like, if you work for someone, you'll work like what, full time, 40 hours, but if you work for yourself, you'll always be working. So it's kind of the case when you do go on your own, especially in the beginning. Because you basically have to be doing everything in terms of hiring. You have to, I mean, obviously, when I say you're doing everything, you don't have to physically do everything, but at least you're basically making those decisions. So you're making those decisions. You're either gonna decide on either you want to do it yourself, or do you want to hire a company that's gonna do it for you. So, for example, when I wanted to do all these insurance panels. I 100% did not want to do that myself, so I went about hiring a credentialing company, and I can't stress like how important it is to do your own research uh, on finding a good credentialing company, because there's so many out there. And as soon as you create your LLC, you'll get flooded with ads, phone calls, spam calls, emails, texts. It's pretty insane. We talk a lot about HIPAA, but there's no HIPAA when it comes to your personal information. Once you create the LLC, people will find you, and you got to be very careful. So, I did make a mistake by going through some of these ads, and I learned the hard way. I had to I lost a lot of time, and it cost me money. But I would say, if you're going to go out on your own, it's very, very important to have a mentor, have someone that's been through it before. Your residency director. Alhamdulillah, I've been blessed with having great relationship with my former residency director, Dr. Kotsias. I kept in touch with other physicians that in the area, whether I shadowed them in the past, or that there were friends of mine that were ahead of me. Alhamdulillah, like I kept in touch with them, and those are going to be your guide, really, because there's a lot there's a lot of decisions, and you really, you can either the learn something through doing it yourself and making a mistake, or you can learn from someone who's been through it and already made a mistake. So you save yourself that hassle. So alhamdulillah, so I had a mentor, that person, and or collective information from different people taught me, or learned that I have to have a credentialer, and the forming your LLC, which nowadays it's so easy. You can YouTube it, you can chat GBT it. It will give you like a step by step on how to do it. Even the New Jersey, here in New Jersey, the state website, it it gives you a step by step on how to create your LLC. Forming the LLC, what you need to do, how you need to file, what you need to file, your tax, your EIN number. So the information is out there. I think what's really important is just having a structure, have it structured, having it, because basically you just have to do it in order. For what I think is, like, the information's out there. You just have to have A, B, C, D, because in my opinion, all that stuff is very simple. The hardest part was just, like, selling your services. When it comes to selling your services, that's the challenge, because that's something that we've never taught. We kind of have to learn on the job.
Yeah. So going off of that, so how much did you outsource? Like, did you hire a marketing person? Did you hire a practice manager? I know you said you did the credentialing, but like, how much did you do yourself? Because I know it's tempting to go into private practice, but just outsource everything. You know what I mean?
Okay. So I mean, I would say uh, the billing and the credentialing I outsourced. Me personally, because I wanted to have someone that knows what they're doing. I didn't want to do it myself and then learn the hard way. And eventually, like I know how it's done, but it's not something that I wanted to do myself in the beginning. Especially, for me, I really wanted to uh, go really, like, go hard and go fast, like that, just like put it put the pedal to the metal, like they say, in the beginning, because that's when you're facing the most friction, is in the beginning. And I think, having that team, so having a credentialer, having a biller, you might be in a situation where you want to hire a practice manager in the beginning, but I know I didn't need that. Just going about my the way I structured my business, my practice. And then also, I wanted to be the face of the practice, so I didn't really hire a marketer, because I had a lot of downtime in the beginning, so I was doing the marketing myself. And I think it just matters on, like, where you market and who you market to. So you really need to have, like, a strategy. And what I did was, I approached, like, primary care doctors. I found the most luck with was actually nurse practitioners. I found them to be, like, very easy to work with. And primary doctors, they have so many people reaching out to them. You have your company reps, you have other you have they're just being pulled from every end. And I found that nurse practitioners were a lot easier to work with, and the referrals were a lot easier to come by from from the nurse practitioners. So I did all the marketing myself. I did obviously the referral sources, building that referral base myself. And I still do it till this day. And I don't find that it's, like, overwhelming, as long as I stay organized. So I keep an Excel sheet of my top referral sources, and those guys, and those people, I follow up with them consistently.
Got it. Now, this question is maybe more for students who may be considering private practice in the future. Is that a realization you had after you worked for other people and you realized, like, no, this is not it for me? And what advice would you give to somebody that maybe wants to go to private practice? I know there are, like, residencies or fellowships that say, like, oh, this will set you up for private practice. Like, do you think those are worth it, or not really?
I'm sorry, Junaid, you said fellowships that.
Yeah. Some fellowships
Okay.
will say, like, this will set you up for private practice, like that kind of thing.
um I mean, I think the most amount of information that you'll get for private related to private practice is the information you get from talking to other podiatrists that are in the private practice setting. So, if you do, when you're in residency, a lot of the podiatrists you meet are in the hospital setting. Whether you scrub with them in the OR, whether you meet them in PACU, so there's that. There's you're basically going to be, the bulk of the conversation is going to be about hospital work, which isn't significant, isn't a significant part of private practice, unless you want it to. But for the most part, from talking to my colleagues and myself, most of my volume comes from the community, not usually the hospital. So I would say, if your fellowship is in a private practice or an office, and that's what you want to do, then great. I think it's really uh, it's all about realizing what you want to do early on. That way, you can talk to people who are podiatrists who are in wound care. Talk to podiatrists who are rehabs or nursing homes, because that there's a lot of nuance and a lot of details that you won't really be able to pick up unless you're in the field. I'm sure it's the same thing like with academia. You know, if if I wanted to go into academia, I can't just like go into academia without knowing the things that would make me favorable to the podiatry schools, or the medical schools. So it's pretty much the same way. What makes you favorable to a nurse, the rehab centers, nursing homes, or wound care centers. So it really matters uh, who you're learning from. If that answered your question. If not, then if there's a follow-up question to better explain it.
What about you personally? Like, did you always want to go to private practice, or did you realize it like afterward?
Gotcha. So it was a mix of both. I always wanted to have something that's mine, but also, I wanted to work for someone and learn, the ins and outs first, because I wasn't confident that I would be able to go into private practice from the get go, you know from residency. So it's something that I developed while in residency, I would say. During COVID, there was a lot of downtime. A lot of our surgeries were postponed, so it was a lot of time for me to think about what I wanted. And I think being around other practice owners and seeing what they do and how they run their practice, and learning, okay, well, it sounds like this is just, it's about organizing, about being resourceful, about, seeing the patient, selling your service, following up, and then having that organized in your head, and eventually figuring out a way to do it. So I think it takes time, but it's really important that you develop the mindset that this is what I want to do, because I think to build the confidence takes time. So knowing what that you want to do it, and that's something that I knew that I wanted to do it early on, but I it wasn't until residency when I pushed myself to like be around other podiatrists and other practice owners that I am like, okay, you know what, this is exactly what I want to do.
Yeah. A lot of podiatrists say that private practice is dead, right? Like, it's the majority of people I talk to say that. So how do you feel about that statement? And do you think it's true, or why not?
Um, so it's not what it was before. That's very true. It's not. One of um, the doctors I met through my training, Dr. Brandysky, he would tell me that when he would do a bunion, He would do the bunion, let's say on a Friday, and then the staff would send the patient like a bouquet of flowers and a call the following day, checking on him. And then, the following week, the patient would come in and, they would get like VIP treatment and everything. And I was like, wow, like, how are you able to do all that? And he was like, well, bunions back then reimbursed about like $10,000 or, $9,000. So you do 2 bunions a month and you're set. So it's definitely not what it was. Uh, I think that's like the golden age of medicine, but I still think there is a lot of opportunity out there. Um, and my theory. Sorry, I don't know if you guys can hear me. Can you guys hear me? Okay.
Yep,
Yeah, I
I
can
can
hear
hear
you.
you.
My theory is that it's all about the how good of a service you're providing, because if you are providing excellent top-notch service, no matter what field of podiatry you're in, whether it's wound care, rehab, nursing homes, if it's sports medicine, whatever it is, if you're providing the best level and quality of care that you can provide, the patients will appreciate that. The staff at the hospital or at that rehab center will appreciate that, will get noticed, and you're gonna, you'll see that your phone won't stop ringing. You're gonna get flooded with referrals. um, so I think, maybe those podiatrists that do say that, they're maybe they come from that old school thinking, that, or maybe they're a lot of times, I agree with them that it's not what it was before, but I think there's still a lot of opportunity.
You've faced up to this point, and how did you overcome them?
You cut off for a second, but you said what problems I've faced. You said.
The biggest challenges you faced. Yeah.
So the biggest challenge, I would say, like the two biggest challenges I faced in the beginning was credentialing, because there's a lot of insurances that they won't let you on their panels for whatever reason. They'll tell you, hey, your area, your state is already saturated, so our panels are closed at the moment. And you just have to be like persistent. You have to keep calling. And a friend of mine told me a really funny way he got on one of the panels, was that he called the rep and he told them, he's like, listen, I have all these Aetna Better Health patients that want to come see me. I think I'm going to give them your number and have them call you, uh, so you can find them another doctor, because I don't take their insurance. And he said, he was waiting to get credentialed months, and once he told that rep that he's gonna give out his number, within like a week he was on a Better Health panel. So it just comes down to like persistence. You have to be persistent. So that's what I did. I wasn't on United Health Community. They just gave me a very difficult time, and a lot of my patients were United Health Community, and I just didn't stop calling. I would have my staff call. I would have I would send emails, and that, alhamdulillah, finally I got on their panel. That was the initial uh difficulty in the beginning. And then I would say, ongoing difficulty, and just and how I overcome it is just selling was never my strong suit. I was never a salesman, and I was never trained to be a salesman. But it's something that I believe you have to have as a podiatrist, because you're basically selling your service. Because there's a lot of podiatrists out there. You're basically, you want to sell your service, and you want to sell yourself as, unique, and which I totally believe that's the case, based on like how, what I provide. So that was probably the biggest thing, is just developing that mindset, that you figuring out who you want to sell to, and then figuring out how you want to do it, and then just repeating that process, not giving up, not giving up if a patient says no, or if a facility decides that they have another doctor, or whatever it is, whatever the situation is. um, I see that there's a question about outsourcing credentialing. Okay. All right. So we'll get to that in a second. So yeah. So basically, just being in that mindset, and no, just basically figuring out what's going to work for your business, and if it's something that it's not inherently in you, just no, just but your business depends on it. As long as it's legal, you know that you have to do it. There's no, unless you can outsource it. But I think when it comes to being the face of your business, being the face of your practice, you really want to be the face of your practice. And it's not easy, and it just comes with daily repetition, daily, practice, doing it. I remember our anatomy professor. His thing was always practice, practice, practice. Uh, and that's the thing. Just keep practicing the your weak point. And eventually you're going to get to a point where you're confident enough, and you'll be able to accomplish that.
Okay. We'll try to hold questions for the end. I will try to hit on some of the stuff that's being asked. So, this kind of goes into the financing part, but, as Muslims, we always fear that we're doing something unethical, or we're like being shisty, or, maybe being, kind of walking that fine line between like committing fraud to like even the way people bill nail care, sometimes it's like, it's not always legit. You know what I mean? So like,
Right.
how do you kind of deal with that, or cope with that? Like, do you feel like you've been having to compromise anything, or do you feel like, alhamdulillah, like everything's fine, like you don't have to really compromise anything at all to run a successful business?
Yeah. I think it just comes down to alhamdulillah, like I have not had to compromise my morals. But it really comes down to um, when you're building your practice, you really want to know you what type of services, or basically have a blueprint of what your practice is going to be. So for example, if you want to provide podiatry services, you really want to be very specific on what kind of podiatry services you want to provide, because you might come across, for example, if you want to do wound care, are you going to do grafts? Well, getting into grafts, there's a lot of shady business that goes into it. So if that's something that you want to do, do your homework, see what is the right way to do it. And I think it comes down to having the right team, so your biller, uh, someone that is trustworthy. You speak to them, you tell them, hey, this is what I want to do. How am I supposed to bill this? and what's the correct way. And you can always reference what they say and cross-reference with Medicare guidelines. So you want to do your homework. Obviously, you always make the intention that you never want to do anything haram, you never want to do anything wrong. And if it does happen where you're walking like a fine line, always just take the safer route. That's my opinion. So even for nail care, for a patient that I'm not sure if this would count as like mycotic debridement versus trimming. I'm just gonna bill the trimming, and because I'm not 100% sure if if this qualifies as mycotic, so I'm just gonna go with the trimming. So so things like that, you definitely want to just uh, side on the side of caution, be on the side of caution when it comes to the billing part. And then you could talk to your biller. Listen, this type of service is new to me. Am I billing this correctly? For example, when I first started, um, the, the the podiatrist that was there before me, they were doing uh, nail biopsy, but it wasn't. It was basically nail clippings, but they were billing it as nail biopsy. So, after talking to the biller and seeing what the Medicare guideline is, then it's clearly not nail biopsy. So you definitely just want to err on the side of caution. And when when you're creating your business, I didn't want to take out any loans. Alhamdulillah, and I haven't taken out any loans. I have enough student loans, and so may Allah forgive me for that. But I just didn't want to take out any additional loans to buy my business or fund my business. So I wanted it to be bare bones, where to the point where it will be functional, but it's not gonna be like super lavish. It's gonna do. I have my autoclave, I have my nail nippers, I have my sanitation bags, I have my sharp containers, everything that will make this a functioning practice, but I don't have to go overboard, so I don't have to like take out loans. And I think once you have that intention, that translates into the rest of your work. So when you're at a crossroad, because you made that intention, you're more likely to take the correct way. And inshallah, like if it does happen that you make a mistake, you do your best to rectify it, and just you make you ask Allah for forgiveness, and you just learn from your mistakes so you don't repeat it again.
That's huge to not have loans for your business. I mean, that's the dream, right? That's like the dream for a lot of us.
It's possible in podiatry, I think. I think it's possible.
Yeah.
Depends on how you structure your business.
Right. Did you like save up for certain purchases, like while you were at your other job, to buy the equipment, or how did you kind of go about that?
So this goes into being having like good relationships with your former doctor, your former boss, your former classmates, or your former residents. Just having good relationships with them. So I actually ended up leasing office space from one of the doctors I used to work with, and I basically structured the lease where I'm leasing the equipment rather than leasing the place itself. Because I started out in rehab centers, nursing homes, I didn't really need an office space, so I leased the equipment from them. And they were an older podiatrist, so they weren't there 5 days a week, so they didn't need their autoclave. And And I was very, very uh, um, careful with his stuff. I wouldn't. I made sure that they were sanitized afterwards, that they were placed in the autoclave, that if anything got broken, and I would pay him for to replace it. So I think in Islam you say al-muamala, like the how you treat the person, really pays a lot of dividends, more than any like business course will teach you. So I think that like treating them well, treating those former bosses and former classmates, or well, really paid off a lot, because alhamdulillah they helped me so much. I honestly would say I would have to take out loans. I'd have to um, be in a tougher situation if it wasn't, for the support system. But I also like, there's a, I also like, didn't live above my means. And, for anyone that's interested, there's a very good podcast, uh, as well as book. It's called The White Coat Investor. I'm sure a lot of people have heard about it at this point, but it's basically he's an emergency doctor, I think out of Utah, and he talks about living like a resident, even as an attending with an attending salary, and then with that money, allowing that money, whatever extra money you have, whether you're paying off your loan or being debt free, or having that money to invest. So I think it also goes back to like your daily habits. So and I would recommend that book and that podcast to anyone looking to have that lifestyle, which is like living like a resident, even though you have an attending salary. So having the support system, having a good spending habit allowed me to take out no loans, and then start the business. And I also was fortunate enough where I started back like towards the end of my residency. So I started putting like the legal stuff together towards the end of my residency, and I actually was shadowing some of the doctors at the nursing homes, at the assisted living facilities, because I wanted to learn like the details, the little nuances, that made the bu- excuse me, made the practice thrive.
Awesome. That's great advice. Now, last question I'm going to ask before we get into Q&A is, what are just some general pieces of advice for anyone looking to get into private practice? Like, or what was like helpful for you? Like, what were you told, I guess? Like, what would you kind of carry on for anyone else looking to get into it?
Definitely surrounding yourself with the right team. That includes that includes the mentor, someone who's been through it. Um, then having the right team for your actual office. So if you're when you first start out, you're gonna need a medical assistant. Right now, I'm at a point where I use a virtual assistant for a lot of my scribing, a lot of my my back office stuff is done through a virtual assistant. And then alhamdulillah, like I feel completely fine doing all the labor intensive stuff, for the day-to-day stuff myself. I find that completely fine. I think also because with the type of practice I set up, which is in nursing homes, which there are already staff there that will help you. So having so the mentor, the office staff, and then also just getting used to developing the necessary skills for for private practice. So I don't know where I learned this, but I think it's very, very true. So they call it the 3 A's of medicine. So it's availability, um, affability, and ability. So, being available. So meaning that if you are going to go in private practice, make sure that you're gonna have the time for it, uh, because what I find, what I see happen is, some doctors will say, hey, I wanna go into private practice, but the hours they provide to their clients, to their caregiver, to their patients, are very limited, right? So you're not going to be able to see patients, especially when you're out. I was saying yes to everything. If and which I learned also, it can be very, very difficult to say yes to everything. But that's what I wanted to do. Like, I just wanted pedal to the metal, and I was available to everyone, everything in the beginning, and then now, alhamdulillah, like, I'm able to scale back and put up, limitations. But I was available. Yes, exactly. Say yes until you're busy enough to say no. Absolutely. And then affability. So one thing, alhamdulillah, that a lot of people tell me, like a lot of my patients tell me, a lot of the nurses, and the people, the staff that I work with on a day-to-day basis, it's like, doc, you're very approachable, you're very easy to work with, and I hear this a lot, and I feel like, as Muslims, like, we should set the bar high. Is like, the doctor before you, I just couldn't talk to them, because they were to themselves. They never talked to anybody. They're very hard to reach. Or they were just, or they were mean. And I would hear this to with patients, which really shocked me. It's like, you're the first doctor that explained this to me. Okay, I mean, all right. Like, I'm sorry that you've been dealing with this issue for like 10 years, and I'm the first I can explain it to you. But it really is that simple. Just being likable, and it's not like, you're just smiling at everyone like, hi. No, you're providing. Uh, Muhammad, you're providing. Um, a value. You're providing value to these patients, to these these facilities, the staff. Whether it's explaining something, whether you're giving an order. Some doctors, what I find is, they see the patient, they leave the facility without even putting their orders in, and now the nurse has to scramble and find out, like, okay, do I put iodosorb on this? Do I leave it, wet to dry? Like, what am I supposed to do here? So, and like, doing your notes on time, showing up when you're supposed to. So that I think is what affability is. And then ability is like the top of the pyramid. Is once you have you give people your time, you give people, you're approachable, then you're able to show people your skill. And that skill can be whatever you decide to focus on. It could be wound care, it could be surgery, it could be uh, you know uh, sports medicine, it could be, nail care. If you decide to focus on that, and that's your bread and butter, then you want to be the best podiatrist out there. You want to make sure that that patient is going to leave very happy that they came to you to trim their nails and calluses. So you give it your best shot. And you can show your skill, and that also means that, if you have to take courses, if you have to if you have to buy the right equipment, whatever you need to get the job done.
Excellent advice. That's great. Let's spend the last couple minutes here with question and answer. I know we already have some in the chat, so Nyla, if you're available, do you mind just reading off one of your questions?
Thank you so much for your time. I'm just going to refer back to what I wrote. So my question was the outsourcing of credentialing. I know you mentioned that being one of the most challenging aspects. Can you expand a bit on that? How exactly would you outsource it, or if you have any companies, or how would we go about searching those companies? And then additionally, I know you touched on financing. Actually, I think you touched on a lot of the financing, but just to add on to the first one, what are the big item costs if we don't have someone, don't have a setup that you had where you were able to just lease the equipment? Thank you.
Yeah. So I would say for the credentialing, there's I can share the person's contacts. They did my credentialing and they were excellent. Essentially, you're basically paying someone to go through all the insurances, all the different Medicaids, Medicare, fill out the application, submit it on your behalf, follow up with those insurances, make sure that they have everything they need. Medicare will do a site visit, make sure that they also have that scheduled. uh so and I'm fine sharing that person's information. Maybe I can give it to Junaid, and I can send it in a mass email, the company that I used. And you're more than welcome to use anybody you want. But I would say definitely use someone that was that's recommended through someone trusted. Because you'll be like me, who I just went with anyone in the beginning, and then I paid the price. And then the big ticket items, I would say the biggest is going to be your autoclave. That was my most expensive item. And then I just invested in like high quality uh, surgical instruments. So, nail nippers, rasps, your blades, your blade handles, um, your retractors. Those. It's going to cost you, depending on who you buy it from, um, up to like $10,000, I'd say, give or take. And there's option to buy a refurbished autoclave. That's something I did. I bought a refurbished one eventually, and it worked excellent. It came with a 1 year warranty. Alhamdulillah, like, this is the second year I'm using it, and it's been totally fine. So I would say, those big ticket items are going to cost you, but you really want to just buy like really good ones. The company I buy from is located in Staten Island, and Brooklyn, I believe. So, they're based out of America. They use German stainless steel on all their products. And you'll be able to get your. I live in New Jersey. I'm very close to Staten Island, Brooklyn. So I never had to do this yet, but I always said, in the event that I get like crappy instruments, I'll go throw it in their face if I have to. But I haven't had to do that yet. So, but I would say, my recommendation is, you want to buy it once. Even if you have to spend a little bit extra, it's better to buy high quality instruments than to keep buying, you know, uh, cheap nail nippers that are going to break on you. And, one, you might hurt the patient. The patient will be frustrated, and now you're frustrated, and you lose out on time. And your reputation is everything, especially in the beginning when nobody knows you.
Thank you so much.
Yeah, you're welcome.
I'm gonna add one thing to that, and hopefully I'm not cutting out, but I helped to build the podiatry program where I'm at from like the ground up. So I was involved with the purchasing for everything basically. And yeah, I mean, some of those podiatry chairs, like if you're in an office setting, it can cost $20,000, $30,000. Those chairs are very expensive. I think the second item that was very expensive was the Dremel, like the Dremel that we use with the vacuum attached to it. That thing can cost 4 or 5 grand, right? So just that alone, like things we take for granted in our school setting in residency, those things are very expensive. But again, it depends on your practice, right? Some people want to have like a surgical suite in their office. Ultimately, it depends on the setting too, right? I mean, that's kind of like the big thing. It's like you said.
Exactly, Junaid. You know, you tailor it how you want, and I think you know, it's all about functionality. If you can build it where it's functioning, um, you know, you don't have to buy the most expensive chair, but you want to buy like a high quality one. You know, I I would buy like a refurbished high quality chair over like a you know, a cheap new chair, you know. So that's my personal opinion.
And then, were there any other specific questions in the chat or anywhere else that people want to ask?
Yes, I had a question, if that's okay.
Yes.
So, just kind not to prolong the conversation further, but I'm thinking of possibly starting something down the road. I'm currently employed by my hospital, been there for a couple of years, and whenever I speak to somebody who's in private practice, one of the things that they tell me off the bat is, I mean, I don't know if they're just saying that for the sake of it. They say reimbursements are horrible, insurances are a headache, it's not worth getting into. What is your opinion on that? Do you agree with that, or is your, you know, outlook different?
So yes, reimbursements are bad. Uh, but you know, the thing is, like, I think it's important to know those things so you make the correct, you make the right strategy. You know, a lot of times, these things, you know, we hear them and we're like, okay, you know, I don't want to get into it. But the thing is, you have to think about the person that's hiring you. You know, okay, well, you work, you're different because you work at a hospital. But let's say, you know, the person that's working in a private practice in a multi-specialty group, you know, that group won't have their doors open if they weren't profitable, right? So, you know, maybe reimbursements are worse than what they were 5, 10 years ago, but there's still opportunity.
Mm-hmm.
You know, there's still opportunity, whether, you know, like for example, I try to limit my costs as possible. So you know, I cut, I don't have an in-person MA. I have a virtual assistant that's based out of Pakistan, and it cost me $7 an hour. So, you know, that
Mm-hmm.
person does a fantastic job. He's my scribe. He's able to make my schedule. You know, he's able to start my notes. He's able to you know, when I get medical record requests, he's able to send those. You know, so all that, it would cost me maybe $20 an hour if I were to hire someone here in house,
Mm-hmm.
and then that person might not show. That person might cancel on you. Yeah, which I had in the past in another practice. So, you know, so I would say, you know, yes, like it is true without a doubt that reimbursements are worse than what they were 10 years ago, uh, but there's still a lot of opportunity out there. And it's all about your strategy. And my strategy is I keep costs down. I work off volume. I make sure that, like, I see a lot of patients. I still keep. I see a lot of patients up to a point where I'm like, okay, this is gonna uh, lower the quality of my care. Then I keep it at that level. So lower, keeping your cost low and seeing high volume is my strategy, and that's what I do, because, like you
Okay.
said, the reimbursements are terrible.
Okay, yeah, and if you could just please share your contact information for the credentialer.
Yeah, absolutely.
Thank you so much.
Yeah,
You're
you can
welcome.
just share it with me, and I'll just send it out to, I guess, the whole mailing list. I mean, that's fine.
All right, sounds good, inshallah.
Any other questions?
I think there was one question about expanding about the materials, I believe. Let me just see if I can open. I'm not able to find it.
It may have been the big item costs. It might have been kind of what we talked
Okay.
about.
Yeah.
I did want to say one thing about financing. Alhamdulillah, you were able to not take any loans, right? So this kind of goes into the realm of like Islamic finance. If I'm cutting off, just let me know.
No, you're good.
You really have three routes. I mean, one route is the one that you took, is just save up, budget properly and don't take any loans, right? That's the first option. The second option is, if you're a little bit more worried about taking loans, but you want to adhere to like Islamic finance, Islamic principles, there are companies that will give you like small business loans, right? Like UIF, Guidance Residential, like the same ones that are giving like Islamic mortgages, right? A lot of these are they're also giving Islamic loans for businesses too. If it were up to me, because you do have scholars that they've approved this system. And then the third opinion is you just use whatever bank you want, right? Just go to Chase Bank and go get a loan like everybody else. So in terms of like financing things to get started, I think those are kind of your three main options, right? Would you agree for the most part?
Yeah, and I think there's another option as well, Junaid, which is like, family members. There's maybe your uncle, your grandma, your father, your mom. They have like extra cash laying around, and they're not doing anything with it, and you can say, hey, I'm gonna borrow this 10 grand, this 15 grand, uh you know and pay you next year, or you can set up a payment plan. So you just I would say, like, exhaust all your options before taking out loans. uh I totally, like, I firmly believe that, if you make the intention that you want to go about it the halal way, Allah subhanahu wa ta'ala is going to make it easy for you.
Absolutely. It's not about how much money you make, or it's about the barakah that you gain with the money that you made, right? That's the more important thing. So,
Absolutely.
but no, Jazakallah khairan, man. This was awesome. And even myself, someday I think about this, right? Like, is this something I want to do? So this is awesome for me. Does anyone else have any other questions or anything before we let Dr. Amr here go home? Poor guy's still in his car.
It's all right, man. Well,
So much for your time.
I'll be able to make it for bath time, so that's good.
When are
Thank
you
you
going to
very
start doing dances on TikTok?
Dances on TikTok.
Like all the other doctors out there.
Oh man, I mean, maybe like the shuffle or something. I don't know. And My wife would just laugh at me. She
Thank
already-
you very much for your time, my brother.
You're welcome, Jacob. It's nice seeing you, man.
Likewise, brother.
He's
Appreciate
hiding his
you.
face.
May Allah make it
He's-
easy
he's
for
the
you.
one that- Yeah.
Inshallah, inshallah.
Thank you so much.
Oh, look at that beautiful face. Yeah, you're
Um,
welcome.
Assalamualaikum, everyone.
All right. Take care,
Masalam.
guys.
Thank you very much. Have a great night.
Thank you.
Yeah, you too. You're welcome. Assalam.
Like I'm saying.